AUC over MIC, it's certainly easier to use ClinCalc than to do all these calculations, isn't it? And then when you adjust, the adjustment isn't too hard, but okay. Aminoglycosides. What time is it? Okay. Aminoglycosides. So we're going to shift gears now. We're talking about another group of drugs. They are, what kind of killers are aminoglycosides? These are the concentration dependent killers, right? These are the ones that need the high Cmax to punch it out. Use it. Now, you're going to think people get vancomycin and aminoglycosides mixed up because they're both IV. They're both used an awful lot in hospitals. They both cause nephro and ototoxicity. They're both IV only. They both need to be kinetically dosed. So people get them mixed up. Big difference. Vancomycin is a gram-positive killer for MRSA and other gram-positive infections. Aminoglycosides in general are primarily used for gram-negative infections, like Pseudomonas. So different goals as far as which bugs they're active against. Okay, that's one big thing that's very different. What's the other big thing? Vancomycin is a time-dependent killer. Aminoglycosides are a concentration-dependent killer. So we have different goals, don't we, as far as the pharmacokinetics and what we're shooting for to help the bug get killed, right? Everybody with me? They're also both primarily cleared by the kidneys, both IV only. Aminoglycosides have very little protein binding, so you don't have to worry about that. They both have no nephro and ototoxicity, as I mentioned. This is given in 40 milligram increments usually. And again, if we look at traditional dosing goals, we based upon the Cmax times the or over the MIC, or the ratio between Cmax and MIC. So again, we would determine our tau. I think this is a negative here. I don't know. Anyway, and then determine, we're going to be targeting a Cmax, not a Cmin, right? Remember, we want a really nice high Cmax. So we're going to target our Cmax. We don't care much about the Cmin as far as efficacy, do we? It's all about getting that knockout punch. The Cmin for aminoglycosides is important to decrease the risk of toxicity. But again, this is just, here's our CSS. Here, this takes us to our Cmax. And then this takes us to where? Steady state. So this is our max at steady state. You can rearrange this and solve for dose rate, right? And again, dose rate times your time of infusion equals your dose. So this is what we used for when I was in school all the way through, and it's a pain in the neck. A lot of calculating. They still may make you do that. I don't know. I don't teach it anymore, so I don't know what they make you do. But there's been new thinking about how to dose aminoglycosides. And that's called, some people call it once a day dosing. I think that's a misnomer. It should be called extended interval dosing. Remember, this is a concentration dependent killer, so we want a high Cmax, and we also like to have some extended time where we're below the MIC, which allows the kidneys to recover. We found that if the concentration gets below 0.5, the kidneys can actually recover from any damage that's been done by the drug earlier. So allowing it to get below that, certain Cmin is actually what we need to avoid toxicity, which is the opposite of every other drug, right? Every other drug, we're looking at high peaks for causing toxicity. This one, we're working to make sure that we have low troughs to avoid toxicity. So someone said, look, we should just really be having very long dosing intervals because we want a huge peak to trough ratio. What do we control? The dosing interval, right? So we want to extend the dosing interval as long as we can without compromising. We still need to be punching at the bug, don't we? We still need to be punching. So rather than going for more conservative peaks and troughs, we're going for more extreme peaks and troughs. So it's called extended interval dosing. We used to give about 2 milligrams per kilogram. We're now giving 7 milligrams per kilogram. So that shows you the difference in some of the dosing methods. So this basically just follows the pharmacodynamics, doesn't it? And ensures that you're getting the best approach. So we want this high Cmax to MIC ratio. So a very large peak to trough ratio, which means we're going to extend our dosing interval. We're also counting on that post-antibiotic effect that I mentioned. So we're counting on the fact that there is a continued post-antibiotic, there's a continued effect on the bug, even though we've fallen below the MIC, probably because of the mechanism of action. So the good news is that we have nomograms to do this. So if you look at this, this was the first nomogram that came out with extended interval dosing. And I'm sorry this is so small, but here you, as I said, we went to 7 milligrams per kilogram. So you look and figure out what your patient's creatinine clearance is, and then it tells you when it's given. When the kidney function falls below 30, or I guess below 30, this is not recommended, because you give one dose and it might be a week later. Well, that's not effective, because you got to be giving the drug more often than that to kill the bug, right? So this shows you how, so this is a lot easier than dealing with those giant equations, isn't it? So we like this nomogram. And here's how we actually, adjust too, once we know how the patient is handling the drug. We're going to do a case with this in a little bit, so that you can have some practice with using this nomogram. I'll tell you, it's much better than what I had to do, which is a huge equation, all kinds of equations. Okay, so we've already mentioned ClinCalc and global RPH. ClinCalc offers a wide range of medical calculators, opioid equianalgesia. So if you need to move between different type of opioids, it'll calculate creatinine clearance, a lot of other stuff. Global RPH probably has more, is probably broader as far as the number of medical specialties that it includes. I really like ClinCalc better for most things, not everything, because, and it does have Bayesian kinetics. Global RPH doesn't. I think what you're going to want to do is get in there and play with it, you know? And you've used it already, Harbin? Has anybody else used it already? Either of these? Okay. I think you'll be excited about what it offers. And it's internet based, so you can pull it onto your phone anytime that you need it, which is pretty nice too. All right, so why don't we take a quick break, and then we're going to do some practicing. Okay, we'll do a couple cases, and then you'll be on your way. We'll talk about the rest of the semester, but let's take a 5-minute break. I have to go get your cases.